Your local news authority. Local, in-depth, community. You're watching KFDX3 News at 5.
Good evening. Thank you very much for joining us. I'm Daryl Franklin.
And I'm Melanie Townsend. Texas is currently battling an influx of COVID-19 cases, with a new poll showing nearly 2/3 of Texas voters say the spread of the coronavirus in their state is out of control.
Now, to talk about this and the state's COVID-19 preparedness, we are joined now by the top medical advisor to the governor, Dr. John Zerwas. Thanks so much for joining us.
Thanks for having me.
Doctor, my first question here is, in Texoma and across the state, we've seen a major spike in cases over the last month since actually the 4th of July weekend. So any word on when a plateau may be on the horizon?
Well, we're actually, I think it's a good question. We're actually in a plateau right now related to hospitalizations, and which, as we all know, that's the thing we're really trying to preserve, is the capacity of our hospitals to absorb people that require care due to COVID-19. And so we're at a place where the last several days we've seen that level off. Again, it's really only important in terms of what's happening in your own backyard, whether that number is going up, down, or staying flat. But in general, across the state, we are seeing that the numbers are not increasing, and if they are, it's not by extraordinary amounts, and in some places we're actually seeing decreases. And so we're continuing to watch that very closely. We were hopeful that we would see some leveling off in the cases after the governor sent the strong directive around masking, and we're pleased to see that it is giving us a little bit of relief across most of the state.
You know, we did a story this week about local nurses who are upset about not receiving hazard pay during this pandemic. That's as the head of the Texas Nurses Association says we're in the midst of a nursing shortage right now. So how do you deal with a shortage and overall fatigue from Texas nurses?
Well, it's a good point, and the nurses are such an incredibly important part of the healthcare system in general, and certainly we're recognizing that in the midst of this pandemic. Truth be told, it's all the frontline healthcare workers, the physicians, the nurses, the respiratory therapists, pharmacists, the incredible number of people that it takes to really respond to something like this. And yes, there is some amount of fatigue going on with this. People are running fast, they're running hard, and we are bringing in nursing staff, physicians, respiratory therapists, all sorts of folks in the healthcare system from out of the state in order to prop up the need, number one, so that we can expand our capacity in the hospitals. But also we're using some of these people to help give some relief to the people that have been on the front line for so long and working so hard. So it's definitely something that's recognized and something that we do hope that as we see some leveling off on the hospitalizations, that at some point we hope that will come with some decline, and we can start giving people that well-earned rest that they need.
And turning now to a big topic, which is face masks. Since Governor Abbott's statewide mandate, there are still a lot of people out there who believe wearing a face mask doesn't stop the spread. So what would you say to those people who have that mindset?
Well, I guess I would probably be fairly blunt about it. They're wrong, and that a face mask is the most effective thing that we can do to try to, bring in the control of the spread of the disease, if we want to continue to be out and about with each other. If you don't want to be out and about, and you want to just stay within your own home, not exposed to anybody else, and if somebody came around, you would distance yourself by 6 feet or greater, then yeah, you probably don't need a face mask. But that's not the way that we need to be as we start to try to get back into some semblance of normality. And so a face mask is just, clearly it is an effective way to help limit the spread of the disease. And there's some science out there that supports that, but frankly it's as simple as a physical barrier between you and somebody else that you might run into, and protecting that person from your secretions and vice versa.
And Dr. Zerwas, what would you say to bar owners right now who say they are not going to survive if they're not able to open up and very soon, and any idea how much longer they're going to have to hold out?
Well, on the latter question, I don't know that because, we're still in the midst of a significant increase in cases. We did find that the bars were areas where we saw some very significant potential for super spreading events, we would call them, which just means that lots of people together in close quarters for extended periods of time and generally not wearing a face mask. And so when we actually, wrote the rules and regulations for bars to open, we were very clear on the things that had to be implemented in order to help keep the spread from occurring. It was very similar to what we did for the restaurants. Unfortunately, we didn't see compliance with that in general, and so the governor did the right thing in terms of saying we need to consider the public's health first, and this was one of the areas that we needed to act on, even though we had set forth some directives in terms of how to safely open the bars. That just wasn't complied with.
Okay. Dr. Zerwas, thank you so much for clearing up some of those things for us.
Thank you. Appreciate it.